differently comes with a cost. In this case, central government, it was a co-commission. They were all co-commissioned with central government, so central government put in extra money to get these projects off the ground, which is probably an important factor. And they were really difficult to get going within the care system. It took a very long time. Obviously, a number of stakeholders needed to negotiate. They were complex. There was a need for outside expertise. Relationships were tricky at times. People took ideological positions, against the way that some of these services were commissioned. Procurement is always difficult to get around. And lack of data on comparable projects also made it quite hard to get these projects going. Nonetheless, get going they did. And in fact, the Norfolk project is one of them. So I will stop there in terms of context. I may say a little bit more about some of the GoLab's work later in the session, but I think let's get straight into it now with hearing from Norfolk. So we have 5 representatives from the project in Norfolk. Tom Jefford is from the provider organisation Family Psychology Mutual. Claudia Cheng is from Bridges Outcomes Partnerships, who are, she'll explain a little bit more about their role. They're an intermediary helping to bring finance and ongoing performance management to the project. And then we have 3 representatives of Norfolk County Council, Sarah Cubitt, Kate Dexter, who will be kicking off, and Kim Mabbott. So without any further comments from me, I'm going to hand over, I think, Kate, to you to kick off telling us a little bit more about the Norfolk project. Thank you very much.
Lovely, thank you. And thank you for everyone who's come to join us this morning. So I'm Kate Dexter, I'm the Assistant Director for Family Help in Norfolk. We've chosen to progress with Family Help as soon as we possibly can. I'll say more about that later. So in terms of talking about Norfolk County Council, I think it's really important to give some context as to why we made the decision to work with this particular project. We really needed to reduce the number of children in our care. We had far too many for our local authority, and we needed wholesale culture change to ensure that our financial package could meet the need and to ensure only the right children remained in care. But most importantly, to promote and support families to remain together wherever safe to do so. And so part of that was something called our Alternatives to Care approach. The Alternatives to Care approach is really about repurposing our financing. So rather than focusing on spending on care proceedings and placements, we really wanted to invest some of that finance into supporting families to stay together, with the view that the savings long term would be exponential, but most importantly, outcomes for children would improve. We were seeing a general increase in children coming into care who potentially could be looked after at home safely, or children who came in that we were really struggling to get back home, where that was the best option for them. So we needed an intervention that could support parents to think differently about their children, to empower parents to make that second, if not third order change, and to really help them to anticipate the needs of their children, whilst also building relationships within the family dynamic where there was family breakdown. I think there was also a recognition that social work practice, particularly in a family and assessment and safeguarding context, is vast. You're trying to deal with everything coming in at the front door, whilst also trying to plan effectively for children who may become long-term looked after, managing child protection, care proceedings, and all the jazz that comes in between. That meant that they were struggling to deliver interventions directly, and certainly families were struggling to hear those interventions delivered by social workers because the relationship was tricky. We're asking social workers to assess, but also to investigate, to support, come alongside families, but then also to fulfil our statutory requirements when we needed to safeguard children. And all of that in the context really of a national and local shortage of social workers, which has become more and more challenging, but has been a problem for a long time. So we really wanted to build a range of support services for families, obviously, to build positive interventions, but also to support our social workers and to help them to feel like there was a team around them. So the team around the practitioner model has been really important. But we recognise also that social work is a particular skill base, and there are many people working in this sector who have other skill bases, other qualifications, other experience that bring a very different and, most importantly, specialist and therapeutic lens to the work we do with families. Coupled with this, of course, we needed to reduce the cost of placements and refocus and target resources in the right place. particularly in light of the sufficiency challenge that we're experiencing both nationally and locally, again, becoming more and more acute as time goes on. But even when we started in 2017-18 thinking about this, it was already proving to be worrisome. And we've been working in an invest to save model. So I'm sure lots of people will be thinking, well, this is great, but it costs money. So how we've been approaching it is, if we invest early in a family, then we save a lot of money long term, because we're not going through expensive proceedings and providing expensive placements long term. And so what we have is a set of savings against the costs of any intervention such as this. And that's really helped us to build a lot of different support services, both as a team around the child, but also as a team around the practitioner. And that's enabled us to embed a really different way of working, a different culture in Norfolk, which celebrates and recognises and embraces this kind of multidisciplinary approach, but also ensures that we've got formal therapy for those families who need it. And I'm handing over now to Tom.
Thanks, Kate. So before we tendered for the work in Norfolk, we already had the basis for a successful collaboration with the Positive Families Partnership in London, which was an outcome-based contract led by Bridges, in which Family Psychology Mutual, my organisation, had delivered functional family therapy. The intervention in Norfolk is functional family therapy child welfare, which has a focus on neglect. This is a systemic, evidence-based model that requires clinically skilled staff to deliver it, but within a social work or early help case. It's a licensed intervention with a delivery length of 5 to 6 months of regular weekly sessions involving the referred child and their parent or family. The intervention is designed to engage and motivate families by building on strengths, with the goal of achieving sustainable behavioural change through the application of systemic family therapy skills and effective communication. As a specialist provider of this service, we know that it's vital that we work in lockstep with the professional system into which we are embedded, and with attentiveness to the flow of the right cases through the referral pipeline, so that we are working with the right cases at the right time. And making the very best of the clinical service really is a joint effort, and it requires strong governance, high use of performance data, and case tracking, so we know where cases are at all times. Now, the clinical support of the programme developer under the licence gives a level of assurance of high quality and model fidelity throughout the length of the programme intervention. So this all requires skill and craft to get right, as we've done in Norfolk. It is entirely possible to take a good intervention and then to implement it badly, then blame it for not delivering, rather than to look at the facilitation of the operational environment into which it's been placed. So, implemented well with committed partners, the programme can deliver and has delivered brilliant long-term results, as we've seen in Norfolk. This can be replicated and scaled in the right context and with the right resources in place in pretty much any other social care setting, but only if there's a long-term commitment and with the dedicated leadership of all partners in play at all times. Claudia.
Thanks, Tom. So to do this, Norfolk FPM Bridges Outcomes Partnership came together and organized ourselves as an outcomes partnership to address this opportunity. So what does it actually mean, right? So it means that everything that we do is organized around this laser focus on outcomes that we agreed on. And so in this case, it is that families do indeed stay together, and that's measured by the number of days that the child or young person that we work with spend in their family home or out of care. Bridges Outcomes Partnerships play this role of enabling flexible delivery and performance-focused ways of partnership working, funding upfront, and working really closely with Family Psychology Mutual, our specialist delivery partner, to deliver FFT to families across Norfolk. In turn, Norfolk County only pays for successful outcomes achieved, that is, measured by the number of days spent by the young person out of care. So what have we as a partnership and families achieved so far, and how do we actually know that, right? So as you know, today we're celebrating and acknowledging this achievement of more than 100,000 days that the 179 families we have supported intensively have stayed together. This only takes into consideration of the one sibling that we work in the family, whereas we know that our family work often involves sibling groups of more than 2. Beyond this, we also know that around 70% of our cohort shows improvement in clinical well-being and family functioning after the intervention, as measured by clinically validated scores. We also know that a majority of our families, more than 70%, have stepped down from child in need and child protection plans since the intervention through the input of Norfolk social care teams we collaborate and work closely with as well. But none of this matters, actually, if we don't know the experiences of our families and social workers with this service, which we gather routinely through our feedback collection. One parent recently said, and I quote, "I would never have believed I would be sitting here writing this now. We are getting stronger as a family every day." So this data-informed way of working underpins our overall kind of governance structure. We use partnership board meetings and reporting to hold us accountable, but also zooming into things and issues that matter the most to us at the right time, and hopefully before they even occur. And Tom mentioned a little bit of this. Some examples are around, understanding factors of improving engagement with the service, identifying families to access the service, etc. And we really believe fundamentally that this unlocks the most creative and focused implementation approach as a partnership, where we can be most confident over the actual outcomes achieved in the most effective and efficient way. Now, Sarah and Kim, my colleagues, will now share with you some of the examples of the Norfolk system and the service and family level system as well. Over to you, Sarah.
Thanks, Claudia. So as part of the commissioning team, we also played an important role in making sure that this worked well as a partnership with Family Psychology Mutual and with Bridges Outcome Partnerships. And we wanted to do this to ensure we got the best out of the programme, as Tom was already mentioned. So this involved talking to the operational teams to educate them on what FFTCW actually is, what the programme can offer to our families, and when it was the right time for them to refer in and who they should be referring in. And over the whole period of time that we've been involved with Stronger Families with Norfolk Children's Services, we have monitored performance using live data, which I think is a really important part of this. So the live data is produced monthly, where we have our board meetings, and we would be looking through this. And it was extremely helpful to ensure we were meeting the needs of our families actually at the time, and that we could keep on top of emerging trends, monitor the families that were coming through and monitor the pipeline, and that if there was areas that we needed to target, to have communication and maybe do more work with to make sure that we had a good flow of families coming through. And an example of how we kept on top of some of these trends was where we started to look at part of the criteria and whether things needed to change slightly. And originally starting this program, we were looking at an age group between 8 to 15, because at the time it started, that was the age group that we were having the most issues with, but it then became quite clear that we would need to extend that. And so we started looking at going down to the ages of 6 and up to kind of like 16 and just into 17, because obviously the program is a 6-month program. So the main part from us as commissioning and the important part that we played was making sure that partnership was good, making sure people were aware, keeping the communication open, and obviously monitoring live data. Kim, over to you.
Thank you, Sarah. Good morning, all. I'm Kim Mabbott. I'm the Programme Operation Manager for Stronger Families. I'm going to share with you just a few examples of the kind of innovation and flexibility that we've created within our partnership and what this looks like in relation to our work with families. So as Sarah spoke about, there were some differences in relation to kind of the age range expanding, and we, as an operational team, were able to respond to those sorts of emerging needs and demands within Norfolk by making a few changes to the team structure. So we expanded the service to be a 2-hub structure, which allowed us to ensure equity of provision across all localities across Norfolk. We also adopted a 2 clinical supervisor structure to ensure that we had robust governance and high quality clinical supervision across the expanding team. And we also appointed a referrals coordinator, which created some additional managerial capacity to help us to manage the referral coordination across the county. There's also an example of how we were able to use family fund within the programme. So every family's circumstances are different and their readiness to engage with services are varied. And we have the flexibility of a family fund to try and remove some of the barriers that may exist for families to engage with our intervention. For example, this may include gym membership for young people, or quite importantly, funding supplies to be able to support safety planning as part of our work with families to ensure that family members are safeguarded within the home. Another initiative we're particularly proud of is the Parental Psychology Fund. So this is a limited resource that can be accessed in circumstances where there may be barriers to engagement or barriers to achieving effectiveness of our whole family intervention. And this can be accessed if there are clinical indicators that an individual parental intervention may support the effectiveness and the impact of the family intervention that we offer, so that there's support for longer term sustainability for the families. That's just a few examples. What's been most striking to us as a service is what my colleagues have spoken to around the joint accountability and the shared problem solving that we've created with us, Family Psychology Mutual, as the providers, and our partners, Bridges and Norfolk. Over to you, Kate.
Thank you, Kim. So I guess that the final question to answer is what next for Norfolk? And I think it's really important to say how much we value the multidisciplinary approach. I cannot express strongly enough the benefit of having lots of different approaches, all working with families at the right time in order to support them. And families really respond to it. We get really great feedback. So the multidisciplinary approach is something we want to continue. And we've developed a number of different services as well as Stronger Families, who work as a kind of a systemic approach, if you like, to supporting families. So we've got Support for Success, which is a reunification, the stabilisation support service for those who are looked after. We've got targeted youth support, intensive support services, such as delivering practical parenting programmes to families, domestic abuse advisors, substance misuse workers, all who work within Norfolk County Council in partnership with us and Stronger Families. And I think that we've been really fortunate to have investment over time from our members, but we've also seen the positive impact, and you just can't account for the outcomes for children and how positive that story is. But equally, it saves a lot of money over time, and we continue to deliver really positive savings as a result of this work. So then on that note, Invest to Save is definitely the way forward for us. And I would say that I think it's really beneficial for a number of local authorities because it enables us to repurpose resources in the right place, in that early intervention and preventative space wherever possible, but also in that space of supporting families to come back together when it's right. And I think it's really important for me to say that with Stronger Families, we're now embarking on an extension to the original kind of project. And that really is about supporting families where children have been long-term looked after to go home successfully and remain at home long-term, and working in conjunction with sort of therapeutic support to do that. Excuse me. And I think that brings me on really to social care review and family help. Norfolk absolutely embraced the family help approach. We already have that MDT response, but we have them as call-in services, which means they sit in separate teams and they come and work with family when we want. That creates its own bureaucracy with referrals, gatekeeping, timeliness, etc., all being a challenge. So we really appreciate that MDT approach, and we're now working on starting a pilot of family help as it's suggested within the social care review. So bringing together that MDT approach into one team where the team can work with autonomy of budget, that delegated authority that comes with it, so that we can really truly support families at the right time, at the right moment, without lots of handoffs, lots of transfers, lots of step ups, step downs, referrals, all the things that drive social workers crackers. And get in the way of that really timely intervention. For us, when families are ready to make change, we want to be there, and we want those resources to be there at that moment. So for us, that's our next step. We hope to go live with our pilot sometime at end of spring, early summer, and we'll happily be kind of willing to talk about that as we go along. Thank you.
Brilliant. Thank you all so much. It's really, really interesting to hear those practical insights and what you've been doing and what you're planning to do more broadly in Norfolk. It'd be great to explore a little bit of this a little bit more, particularly how it relates to some of the bigger ideas in the social care review. We're very fortunate to have Josh MacAlister, who's the chair of the Independent Social Work Review, with us, and I'll bring Josh in a moment to offer his own thoughts and reflections on what we've heard and what else might be able to happen nationally particularly at the local level. But before I bring Josh in, it would be great to hear some questions from our audience. So if any of you have got questions or comments at this stage, please do either raise your hand or drop them into the chat. As you're doing that and thinking of them, one of the things I particularly wanted to highlight from Norfolk's experience is that they have used an evidence-based intervention, a therapeutic intervention, as Tom explained, but I think what has really made it work was the focus on how it was implemented and how it fits into that broader social care system, which is so complex, with lots of different stakeholders involved from within local government and outside it as well. And all of these different sort of versions of accountability. You know, you've got obviously Ofsted, you've got the procurement rules, you've got the social work professional practice, the clinical practice, all these different sort of versions of accountability, which can make it, you know, really hard to kind of collaborate and work together and make that system operate as one. And it does feel like in the Norfolk example, and indeed in many of the other examples that we've looked at in the Go Lab, that is a really important and key feature. It's not just finding the intervention that has a good evidence base, but it's about making it work in that place and in that context. And that really requires that constant attention to governance, to collaboration, to data, to working together, and to integrating as a system. And I think that comes out really strongly in the Norfolk example, and it's something we all ought to really focus on. I think regarding the sort of financing question, so the second of our questions, because you know we had two questions. One, how do we make this work at a local level, and secondly, how do we pay for it? Obviously, the Norfolk case also, you know, is an interesting example of of Invest to Save really working, and you know those 12 million pounds of costs avoided that we saw from this case study. That brings challenges, of course, and this may be something we want to explore later in the session. What's particularly difficult with care days avoided is you can't know for certain who may have ended up in care or not. Obviously, we have, you know, ways of measuring that. We can be reasonably confident, but you know how much particular, you know, let me say the stewards of local government accounts, how much certainty do they need that those are genuine costs avoided? After all, you know, this is really ultimately about making children's lives better and improving outcomes for children and families. But we have to make the financial case, and that brings its own challenges and problems. So we could get into that discussion later if we want to as well. So those were my two reflections. Elaine, you had a question or a thought. Please do jump in.
Yeah, probably a thought more than a bit of a question as well. Absolutely fantastic to hear what's going on, and also, as you've already reflected, Nigel, the focus on implementation. No good having a brilliant programme if it's not implemented well, and also on the focus on Invest to Save and the challenges with that in terms of reassuring those investing that they will indeed save in reality. I'm just interested, I can see a question in the chat as well, which touches on something I was going to ask about the earlier intervention. I was wondering about the age range and then it came up, but particularly interested in those younger than 6 and genuinely early and earlier intervention. And also, and this is one of my reflections on the care review as a whole, and also the DFE response, is the focus on multidisciplinary teams, which is absolutely vital and essential, but also the multi-agency response, and how the example in Norfolk, how this is placed within the wider system, not only within obviously the local authority, but with the wider partnership. And by that, I mean with the voluntary and community sector, as well as the wider public sector partners. Really interesting that one of the funds is access to psychological or psychiatric services. I didn't quite get it. So how does that fit with access, the wider system, and access to the services that the children, the young people, the parents and the families need? So a bit of a comment and a couple of questions.
Who would like to take that? Kate?
Yeah, I was going to say, shall I come in on that? Thank you. So probably dealing with the age range first, and how to anticipate which children, so there is a risk matrix that we use, which is quite helpful in us determining what is edge of care versus what is kind of that earlier intervention. And I think it depends how you set up your Invest to Save, kind of what numbers you've used, how you're providing that reassurance to members and others that it's going to be effective and we're going to make the savings we need to. So we used our own data and we analysed particularly which age groups were coming in to care when they maybe didn't need to, which age groups were children maybe hanging around in care where actually we could get them home successfully, and where our potential savings would be. And that helped us to then develop the criteria. I mean, Kim and others will be able to talk about this probably with more knowledge than me, but FFT-CW is a particularly effective intervention. And for me, it's one that, well, I believe works from 0 to 18, but we targeted very much those young people where we felt that it would have the most impact, and would have the kind of the cost savings attached that we needed it to. In terms of the multidisciplinary approach versus the multi-agency approach, it's a really good question. And this is not about us trying to bring in-house everything so we don't need other agencies. And I think that's really important to say, because I think that's something that often comes up and I hear it from other agencies and their worries of, you know, well, how do we fit into this? And families, well, how does the service knit together? I think what we've realised in Norfolk, the only way to manage financially long term in the current climate is to make sure that every single agency, every single discipline has its place and fits into a wider kind of service network, if you like. So it's almost like a web of services that we'll bring into play to work with families. So we've worked really hard to make sure our in-house services don't replicate something that's already happening with another agency, but also creating those links. So Kim, as program manager, will have links with all our call-in services for that multidisciplinary perspective. And then Kim's input also feeds into our wider multi-agency conversations and work to make sure that there's no duplication of services, but also that there's as straightforward as possible. And I say as possible because the reality can be tricky. But that straightforward interaction between different services to make sure families get what they need when they need it, but in the most straightforward and accessible way. So it's that kind of systemic approach, that integrated approach that's so critical for me.
Thanks, Kate. Something else I can add in from some of the work we've done at the Go Lab. We hosted a roundtable in January asking the question, why does our government not invest more in early intervention and prevention? Not specifically for children's social care. Obviously, this is a policy area where it's particularly pertinent, but in general, you know, look at health, look at any policy area. Why don't we invest more upstream? Why do we wait for things to get to crisis point before we invest? And there was lots that came out of it, but part of it, one of the really interesting parts was sort of, where do you draw the line between universal services and targeted services? You know, and obviously we used to have Sure Start Children's Centres, which were a universal service where the evaluation said, okay, this doesn't necessarily stand up to a really robust sort of evaluation where we can kind of show that the investment saved money. But actually, when you look at other types of evidence, you know, it seemed to be a great success, and lots of the evaluation material makes that claim. And also, by being a universal service, it secured more, you know, political support because everyone could benefit from it. But equally, there are times when actually you do need to be targeted, and choosing who to target is really tricky and really important. And again, a mix of, you know, good analysis of the data that you've got, and frankly, professional judgment. And you can never be 100% sure that you're targeting the right people, but you want to, you know, obviously be as accurate as possible to make that financial and political case there. So, you know, that it was an interesting discussion, and I think, you know, there's going to be a lot of nuance as to where you sort of draw those lines. Many local governments not in a position to offer very much in the way of universal services anymore. We all know why. There's I guess some stuff going on in the youth space, perhaps not so much in the earlier space. But yeah, it's an interesting way to look at the question. You know, there is a line somewhere. There's always lines to be drawn, and you know, targeting is tricky, but is always going to have a role to play. I'll just check, is there anything else in the chat? question from two other questions, which we'll just quickly visit, and then I'll ask Josh to offer some comments. Sorry, 3 questions. Elle, do you want to come in, because you've offered a bit of a comment there in the chat? If you could come in on that, that would be great.
Thank you. Thanks so much for these presentations. I was really struck by what you were saying about the outcomes focused shared accountability and the strong partnership working that you were talking about. And I just wondered whether that had, whether there were particular training and sort of skills development work that you did in order to support teams to work in that way. And also whether you had any reflections on the scale at which this approach might work, if you're thinking about where next, and how big can this get when it seems very reliant on this deep partnership working. So I just wondered if you had any reflections on that. Thanks. And Kate, I saw you nodding, so I don't know if that's one for you.
Thanks, Eleanor. Yeah, they're really helpful questions, actually, and really important. So it's interesting to say, so for Stronger Families, we've been relying on a SIB, and we introduced this really early on, but we learned from it. So we've now introduced in-house call-in services on the same kind of lines. So using that Invest to Save, writing business cases that show exactly which cohorts we might target, what we might save by targeting those particular cohorts, and therefore an investment request. And that's been really helpful. And that means that we've been able to provide interventions at a much larger scale. So Stronger Families actually works with our entire workforce, but obviously we're limited in the amount of resources we have available, and we need to make sure we're targeting the right families. But our targeted youth support service work with all children and young people who might be at risk of exploitation, particularly those who are not yet at high risk, where we want to intervene and reduce that risk quickly, kind of support young people to divert. Equally, our support for success service is very much built on reaching everybody and creative ways of doing that. So what I'd recommend, for example, is that with our support for success service, we have clinicians who support the teams and support teams to feel more confident, more able to deliver interventions as they work with families. Whereas, for example, our targeted youth support might work more directly with young people and will reach a large cohort. So it is scalable. Norfolk's a huge authority, the 5th biggest geographically, and massive services. We have 6 large localities. But actually, you can provide these interventions on a much wider basis and kind of wholesale. In terms of training and development, really it's about promoting a culture. So there is some training. Every every staff member who comes into the service is inducted and is given kind of better understanding of these services, how they intertwine, how they work together as a web, if you like, of different approaches for families. And then that's reiterated, there's further support, further discussion. And I think we're at a point now where that kind of way of working is quite embedded. So for us, that's why Family Help is that next step, is how do we bring it into one team all working together. But actually that MDT approach and understanding who can do what and who might support the family in the right way is really quite well embedded now through a mixture of that induction and ongoing discussion.
Yeah, really, really interesting. I mean, it would be good to dig into kind of the journey and how you've kind of got to the point now where you're able to think in that way and work in that way. Maybe that's something we can come back to. Hopefully, Kate's response there answered your question as well, Joy. We'll just go to David, your question about data as a last one for now. Then I'll bring Josh in and we'll have more time towards the end for more discussion and questions. But David, do you want to, because I know you're joining us from a very long way away at a very unsociable hour. Do you want to bring in your question?
Thanks, Nigel. Yes. So my question was, are you capturing as a data point the entry of families and what the presenting issues are? And have those presenting issues helped you shape the way your multidisciplinary approach has developed over time?
Wonder, Georgia, is that one?
Yeah. Thanks, David and Kate. Bridget, did you want to come in on this answer, or I'm happy to if you wanted to start, or I can start. We can't hear you, Brigitte.
It related to the previous questions too. It's more about identifying the right families and the training of identifying the right families. I think when we started, we made a guidance for referrers where we looked at the risk factors of that are associated with going into care, so that people could identify and think about what are the families more likely on the trajectory to going into care. And then we have a consultation built in. So when they might think it is suitable, then there's a consultation with the supervisors or with Kim to talk more whether or not this family would be suitable. And then at the end of the day, it is also the Norfolk County Council that will decide whether or not this is the right family that they think would be suitable and would prevent of the child going into care. So that's a bit associated with the previous question too. And Claudia, you wanted to answer too?
Yeah, no, I think that feeds in. I think the quick answer is yes, in terms of collecting, presenting referral behaviors and issues from families, both parents and young people and children at point of referral. And Bridget, like you mentioned, the data points also include during the process of having those consultation, clinical discussions, and then impacting the coordination between Stronger Families clinical team with the Norfolk social care teams, hence influencing that multidisciplinary approach by joint meetings, joint agency meetings, etc. That informs kind of the agreement of referrals. On data, Nigel, I wonder whether it's helpful to also speak to one of the questions up front on the outcome focus, if that's okay, just to quickly signpost it, and happy to share further data. I think on the slide, there was a question from Ian on kind of outcome focus, and just want to speak to kind of again, drawing on the clinical experience that FPM and joint partnership with Bridges on using clinical tools to really capture the distance traveled improvement, using SDQ, Core 10, Score 15, measuring family functioning, psychological distress, parental mental health improvements in young people, care experience, psychological distress improvements as well. So those are some of the ways that we capture that as well, underpinning kind of that clinical and data governance. Sorry, Brigitte, is there anything else you want to add on the clinical data? Perfect.
Great. Yeah, clearly the sort of live monitoring of progress is really important to the decision making and the shared governance here. Okay, well, we'll come back to some of these issues shortly, but first I would like to introduce Josh MacAlister, who is was the chair of the Independent Review into Children's Social Care. Very fortunate to have you with us this morning, Josh. Thank you very much. Josh is now the executive chair of the What Works Centre for Children's Social Care and Early Intervention, which is the amalgamation of the Early Intervention Foundation and the What Works Centre for Children's Social Care. So we couldn't really ask for anyone better qualified to comment on some of these issues at a sort of more macro, higher policy level. So Josh, yeah, please do share some of your thoughts and reflections on what we've been discussing so far.
Thanks, Nigel. And I should say at the start that the What Works Centre will be launching under a new name, which is much shorter than What Works for Early Intervention and Children's Social Care, and we'll be launching that in the next few weeks, alongside a new way of keeping up to date with the organisation. So I'll put in the chat after my remarks a link that if people are interested in signing up to keep up to date with the new What Works Centre, how to do so. It's really good to be in a conversation where we're talking about the implementation of some of these changes and the detail of actually how to make them happen, because it can be very easy to stay in the abstract, and actually it's when these things get implemented that we realise what makes it hard, how it needs to be done well, and what needs to be learned. And given that the government have accepted the direction of travel set by the review in relation to many of these questions that we're talking about here, it's a really timely session to dig into big implementation questions. So it'd be good to continue talking about those. Having said that, my remarks do sort of focus, I guess, more on the abstract, given that the review was looking at the whole system. and the sort of fundamental shifts that need to be made in funding, policy, regulation, and outcome measurements. I'll just go through sort of why the review took the decision to conclude on the recommendations that we made, and then we'll get on to some questions. There's a couple of observations just from the conversation so far that I think are worth dwelling on up front. And the first is that the discussion about shifting money within the children's social care system is really the rationale for investment, because it allows children's social care, which is a 10 or 11 billion pound public system at the moment, to fundamentally change its activity without substantially increasing the overall cost of the system. And that is to say that we would really try to reform children's social care so that about £1 billion a year more of that existing budget is spent helping families earlier. And by doing so, it reduces the need for care later. Because of that, the economic case for investment in earlier help for families is incredibly strong in this particular case, because savings are cashable to the people who are spending the money. And that is not always the case in discussions about cost benefits. Now, because of that, it makes it very tempting to stay in a conversation always about deferring children from entering care. And it is important because there is a principle there as well as an economic benefit. And the principle being that if a child can remain with their family where that's safe to do so, it is in that child's best interest and rights to have their childhood realised in a family environment. So it's right on a rights basis, and it's also a really important economic argument to make about how the system needs to be reset. That said, there are hundreds of thousands of children and families who are never likely to come to the edge of the care system, let alone enter the care system, for whom family help needs to do a much better job of improving the quality of their life with their families. And so that's just, I guess, a point to dwell on, that because the edge of care is where there is real interest in changing where we spend our money and changing the dynamics of the system, we can sometimes focus too much on the outcome that we're pursuing, being the reduction of care, rather than it being the reduction of care, the increase in children staying with their families where they can, and improving the quality of life for the hundreds of thousands of children who would not otherwise be near the care system. So that's one thing just to flag. And the second is that the evidence for well-targeted, well-executed earlier support for families grows over time. The IFS, and this sort of goes beyond the scope of my review, but the IFS produced some very good analysis on the long-term benefits of Sure Start a couple of years ago, where they found that at its peak, Sure Start reduced child hospitalizations by 13,000 a year. And that alone covered a third of the entire cost of the Sure Start programme. Now, it's not hard to imagine a couple of other outcomes that would hit on other services finding their way to covering the full cost of Sure Start, or even providing a net financial benefit to services in fiscal terms. And I think the challenge for government, and I feel like I'm sort of coming along making a very tired argument here, because many of you on this call at this meeting, particularly the Go Lab, have been making this argument for many, many years. But really, the lack of imagination of the Whitehall machine, and particularly the Treasury, in being able to account for, not in loose terms, but account for in very tight, rigorous terms, the benefits that are accrued for services in fiscal terms, in getting it right earlier on. That failure to capture that in policymaking is costing us dearly in the cost of public services, the cost to taxpayers, and ultimately poorer outcomes. So I think this is an incredibly strong area to make the case because of the cashable argument. But there are many other areas. I mean, you know, some of the conversations that we see taking place more and more about primary care and public health, the justice system. This is a widespread public service reform agenda, which is only going to grow in importance in the next few years. So I think this is a great place to start, because the economic argument in this particular field of family help is probably one of the strongest. So that's a good omen for us, really. The reason why the review puts such a great focus on this area of work is partly a legacy of the children's social care system that we aspired to in the late 80s, when on a fairly cross-party basis, the 89 Children Act was passed. And in that act, there was a section 17, which described the broad and flexible duty of local government in England to ensure that children could have a good quality of health and well-being. Broadly defined, it wasn't tightly defined, and it didn't stipulate what services should be provided or create a code, a rigid code around how that should be applied. And I think it's fair to say that we never really realised that commitment in the Act. And since 89, since 91, 92, when it was implemented, we have essentially pickled that intention into what I would describe as today the child in need category, being one which is largely about demand management and eligibility management for higher threshold services, which means we spend a huge amount of time assessing families, a huge amount of time referring families, repeating the same processes over and over again, and actually not providing much substance in terms of help that families need. And then when families reach crisis point, we then throw, very expensive late stage and often sometimes ineffective interventions their way, and the family have reached that crisis point. Now, that is documented in the review pretty comprehensively from the views of parents and families. It's also documented, I think really important to capture this, from care experienced young adults who've had time to reflect on some of their own childhood and can see moments at which their family could have been helped and that they could have stayed together. And it's also captured, importantly, from those practitioners working in the field who come into this work as social workers, family help, family support workers, other practitioners, wanting to roll up their sleeves and do change work with a family over a period of time, based on a good quality relationship, using evidence-based approaches, but finding themselves not doing that, but trying to categorize and assess risk, and not having the resources and time to do the help work. And so this isn't working at the moment for anybody. So big change is needed. Now, what the review described is that alongside the child in need system that we've got, which has struggled to meet the original intention of the 89 Act and meet the needs of families that have got often quite practical things they need help with, in response to that failure of child in need to meet its promise, we've created a new category, which is targeted early help. And that has grown up with greater flexibility and often more support. So families would describe to the review the process of meeting the threshold for targeted early help, actually receiving some stuff that's quite useful, problems still escalating, the family reaching the child in need category and then finding the support drops off because of the category of the system that they're in. So there is something really quite fundamentally broken about the categorization that we've created and the circumstances for its creation. So one of the very important things that the review called for was to realise the original intention of Section 17 and defining it as a family help category, bringing together what is currently targeted early help and child in need, and making some fundamental changes to who can do that work, so that it's no longer the exclusive terrain of social workers. It should be social work led, but they should be multidisciplinary teams where case holding lies with the most appropriate practitioner to do the work with family, which may be a family therapist, it may be a drug and alcohol worker, maybe a family support worker, it may be a social worker. So that's the first major change that the review called for in the reforms for family help. The second is a much clearer national definition over eligibility for support and reducing the stigma that comes with accessing this type of service, which links to recommendations the review made regarding child protection that I can talk more about if people are interested in the questions. And a crucial part of that definition for eligibility and targeting of support is doing really good quality population need assessments in each area to actually understand who are the children at risk of not reaching a reasonable level of development and health in an area. And that is the language of Section 17. And it's kind of staggering in a way that we've built this legacy system called children's social care, and sometimes does not bear much reference to the needs of families in an area. Because if we were to look proactively for the families where there are children who meet that not reaching a reasonable level of health and development standard, and then looked at what their issues were and where they were, we would probably start to build and design different teams of practitioners than the ones that we've got. And we would probably do different activity to the activity that we currently do, which links to the third crucial component of the family help reforms, which is multidisciplinary, neighbourhood-based family help teams based in settings that people recognise and can access in the community. Too much of children's social care is hosted, if you like, in council buildings that are deliberately removed from the community through multiple locked doors, sign-in desks and all the rest of it. And that is a bit of an outlier when you compare it to other public services. The fourth is to make this new approach work, resetting some of the national direction, outcomes, objectives and use of evidence, so that the incentives are in place for these local family help multidisciplinary services to work within a more rigorous framework than we have at the moment, which is more focused on outcomes and more rigorous than some of the work that was done with Sure Start in the noughties, where reading back through some of the history of the Sure Start programme, there were concerns that when money was aplenty and Sure Start services were growing at speed, even at that point, the use of the best evidenced interventions was patchy. And if we're proposing to ramp up spending on earlier help for families again now, we need to do so within a really clear framework that puts an emphasis on evidence-based interventions and approaches. So the government have published a very welcome children's social care framework, which sets out some of the outcomes for the system. They've proposed a dashboard of metrics which everybody would report on and would be publicly available. And they've set out ways in which areas would go about meeting those objectives. And they have also proposed that national practice guides, which pull together the best available evidence for achieving those objectives, are published as well. So all of that creates a different infrastructure for doing some of this work. And my expectation would be that the inspection and regulation falls in behind that, so that inspection starts to look at how well a service in an area has matched evidence-based approaches and interventions to a good quality population need assessment in meeting the needs that families have got. And that sounds like an incredibly basic logic flow of how the service should work. But at every current point, in that 3-stage cycle. That is not what is happening at the moment. We don't have a good understanding of family needs in an area. There are often very out of date and very often too high level joint area need assessments that are done. We don't provide the multidisciplinary skilled teams to meet the needs of those families, even if we knew what those needs were, partly because of the statutory framework that limits child in need work to social workers. And finally, inspection doesn't drive services to ask themselves the tough questions about whether they're deploying the best evidenced approaches and interventions to meet the needs of those families using those multidisciplinary teams. And then the final part of this is obviously funding, which is to turn the taps on in a major way to activity within that tightly defined framework, so that we start to see the benefits that we already know are taking place within the children's social care system through work like FFT in Norfolk and the work that the Norfolk team have been doing. And I've spent time with them over the last year and have been really impressed by the approach that they're taking. But also, work that's very long-standing in local authorities like Camden, Wolverhampton, Hertfordshire, the evaluations that have been done of the Supporting Families programme, all of the evidence that's out there, which the review used in a very cautious way to project what might happen to a reduction in care rates as we would start to ramp up the offer of earlier and intensive help for families, which would see us see a reduction in the number of children that are in care over the next 10 years, and avoid us reaching the, I think, very dangerous position of having 100,000 children in England in care, many of whom do not need to be in care, could be cared for by their families. And of course, the costs of that, which would mean, without even factoring in inflation, we'd have £15 billion of public spending on a system which would be more fragile, probably producing worse outcomes, and on a continued escalator of rising cost and demand, which is a description, as I said earlier, of too many of our public services at the moment. So that's my that's my thoughts and observations. I guess we've got some colleagues from government coming in a moment to offer reflections. I would say that the DfE's strategy, Stable Homes Built on Love, has got a consultation open at the moment. It closes in 2 days on the 11th of May. It's worth colleagues, if they've not already done so, having a look through the consultation questions and responding to those. My response to the government's response to my review is to welcome very much the direction that they're taking. And I think if you read through the fine detail of what government are proposing to do, and I know that the teams in DfE in particular are working on, they are trying on all of the activity that I've just mentioned to change statutory guidance, change the outcomes and incentives, and put some money into these parts of the system. I would like them to be going further and faster in how they do that, so that we roll that out across the whole country. But given the decision that they've made, it's really important that this is executed extremely well, so that by the time we get to the next spending review, the case is emphatic for £2 billion of upfront investment to turn the tide, deliver better outcomes for children and families, and create a system that more of us can be proud of achieving its original intentions.
Great. Thank you, Josh, for that really sort of comprehensive rundown of what the recommendations were and sort of where we're up to now. Something that really strikes me, which I would like to dive into a little bit more, is that a lot of what you have recommended, Norfolk is managing to do. So I think there's a question there about how much can be done locally if the will is there, and how much can't be done locally because there are barriers that central government need to clear, or things that central government needs to do to enable the work to happen. And then the third aspect of that is, what more could central government do to get more places have the will, if you like, to do some of the things that Norfolk is doing, and sort of in spite of the barriers in the system. So I think it'd be interesting to kind of explore that sort of centre to local relationship a little bit more, if we've got time. I'm going to bring in a moment you, Hannah. Hannah Smith is the Deputy Director of the team in DFE, who are responsible for the response to Josh's review. So I'll invite you to offer a few comments in a moment. If I may, Hannah. Just before you do, I'll just add something else that came up in our preventative spending roundtable in January that we hosted in Oxford, which relates to your point, Josh, about the Treasury sort of believing the case for investment. And of course, it is very strong in this policy area. It's one of the very few where you can make a case for actual cashable savings. In most policy areas you can do preventative work, but and this a lot of the people that came to our roundtable agreed, you don't necessarily unlock savings that you can, if you like, cash. You don't save money on the balance sheet. You just unlock capacity in the system, which can then be used to help people with less acute needs. So you make the problem less bad, but you're still going to be spending the same amount on the system. And this is one of the very few policy areas where actually you may indeed be able to save money. But almost more interestingly was that a lot of the resistance to this sort of spending comes through the way that HM Treasury classifies spending. And preventative work, like the sort of stuff we're talking about this morning, is not viewed in the same way that capital spending is, as a big upfront cost with a long tail of benefits. So if you're building a railway line, for example, it costs a lot up front, but you get benefits, economic benefits, lasting for decades and longer. And we may not be talking here about quite such a long tail of benefits, but we're still talking about work that has a big upfront cost and a long tail of benefits. And yet Treasury doesn't classify it in that way, or doesn't see it in that way. It sees it as current spend, where it has to fight with all of the other current spend that's kind of dealing with the presenting problems. And the really nice example of this is, if there's a choice between paying nurses more, for example, or doing more health interventions in the community facing a department right now, which they're going to go for. I think we all know the answer. So yeah, a lot of interesting insights there about kind of how the machinery of government can make it hard to make the case for this sort of spending at a national level. Anyway, Hannah, do you want to come in and offer a few thoughts on behalf of DFE and the government's response? And while Hannah's talking, if you've got further questions or comments in the audience, please do drop them into the chat or raise your hand. Hannah.
Hi, everybody. Good to be here today. Thank you very much for having me. It's great to hear all about what Norfolk have been doing and the wider conversation around that. And it's not just Norfolk. We are hearing these kind of conversations happening all around the country, with many local areas keen to already move in the direction of increased earlier intervention, this kind of preventative spend. So the things I thought I would just mention now were, so I guess firstly, the argument about rebalancing spend away from crisis intervention and towards earlier intervention. We do believe and think that the Care Review has a very well evidenced case for that being salient, both in terms of outcomes for children, young people and families, and economically as well. And we do specifically accept that family help reforms in particular have a strong and growing evidence base. And we see the same features in all of these programs, whether it's those that have, the things that come through supporting families, the DFE innovation programs like this one, these core features of multidisciplinary teams, intensive helping, community-based support. There is such a strong evidence base for these factors and the potential impact that they can have on long-term outcomes for children and young people. So in terms of what we're doing now then, as you've said, we've published our strategy, which is our response to Josh's review, and we have really accepted the direction of travel that Josh set out in the review. But the way in which we've said we'll go about addressing that is firstly with the first phase of reform that happens over the next 2 years, which is really, in that phase, we're really trying to do two things. One is to lay the foundations for a longer term change, which was rolled out across the whole country. And secondly is to try as clearly as we can to set direction now. And that's really to address the point that was just raised about local areas who want to adopt these ways of working. How can we create the right framework for them to do that, with or without us, as quickly as they're kind of able to start with that. So I can talk a bit about both of those things. So in terms of sort of laying the foundations for whole system change, broadly we're doing that through a system of pathfinders, which are looking to roll out the reforms set out in Josh's review to a small number of areas. Now, it sounds a bit counterintuitive because I just said that, you know, we appreciate the existing evidence base on family help reforms, which we really do. But I think an important thing about taking a pathfinder approach is really recognizing the complexity of some of these implementation questions that we've been talking about today, and also recognizing the complexity of, we're not just rolling out the family help reforms, we're also rolling out reforms to child protection, to how we use family networks, and these things obviously are deeply interrelated. So the thing that we really do need to test in the pathfinders is how these changes can be rolled out together, and how the interactions between them play out on the ground. So that's why we're kind of taking this test and learn approach. We recognize we can only really do that work in collaboration with local areas with a deep understanding of what's happening on the ground. And then on that kind of second question about how are we sort of setting direction for the system as a whole. So as Josh mentioned, we've moved to publish a draft national framework for children's social care, setting out the outcomes that the system should be trying to achieve, and also a data dashboard that would sit alongside that. So we think that's a really important tool for giving clarity around direction of travel to the system as a whole. And that's out for consultation at the moment, with a view to becoming statutory after that consultation period. We're also moving to do things like update the working together guidance, other pieces of statutory guidance, that kind of thing. Again, with the idea of creating this like enabling environment where local authorities who want to move ahead with these ways of working can do so. And then the other kind of important aspect of that is looking at how we can support local authorities to learn from one another, building on the infrastructure that already exists, to take learning out of the pathfinders and other sources and get that moving around the system, and with this sort of type feedback loops as quickly as possible. So that's where we are now, really. Those are the kind of headlines about the direction we're trying to take in taking Josh's review forward, obviously. And we do appreciate that our kind of £200 million investment is not the whole system rollout, which the care review was looking for, but we are very focused on using the next 2 years to really build that evidence base and build that robust case with a view to future phases of reform.
Thanks, Hannah. Yeah, and I think, as I said earlier, one of the clear things that does come out of the Norfolk case study, and it comes out of other projects that we look at in the Go Lab, and I'm sure others that you speak to in DFE, is the complexity of implementation, and that you really do have to pay a lot of attention to how the different parts of the system work together to make this work on the ground, which definitely is perhaps a bit of the evidence base that is lacking. I don't know, we can discuss that, but certainly it's the bit of the evidence base that we're really focused on at the Go Lab, is the how do you actually make this work on the ground? We know the interventions, we know the evidence base there, but we need to know a little bit more about how to make sure they really work on the ground. And that's something that we look at a lot at the Go Lab, and is perhaps not as well understood from an evidence perspective, or from indeed local areas or bits of central government that kind of oversee these systems. And again, as I kind of hinted at, one of the really tricky questions is how much of this is just about local areas understanding it and having the will to change the way their system works, and how much is it about central government clearing barriers and creating better incentives for that sort of working. And we don't have an answer to that, and we don't have time to get into it right now, but it's definitely an interesting and tricky question as to where the kind of impetus needs to come from obviously both sides, but who sort of does which bit is really key. Okay, we've got a few minutes left and a couple of other comments in the chat. Elle has asked Sarah or anyone else in the Norfolk team for any reflections on what, same question as me really, what should central government be doing to create that enabling environment. So maybe Norfolk team, you could offer a few reflections there. And then, yeah, if we've got any other questions, or there's a couple of other people I'd like to hear from that I might call on. But does anyone from the Norfolk team want to take Elle's question first?
Sarah, are you happy to make a start on that?
Can. Okay, I mean, it's an interesting one, isn't it? Oh, sorry, can you hear me?
We can.
Yeah. I think there is an element of, I'm going to say culture, do I dare say it, culture change? I mean, it is something that, if we're honest, and this is a government thing, a public sector thing, we have a way of doing things, we have a way of running contracts, we know that works, that we have performance management frameworks in place to enable us, already embedded, that enable us to monitor these things and keep on top of it. And I think this new way of doing a contract has been a very interesting learning curve. And I think that for me, yes, there's definitely, I think there needs to be an acknowledgement maybe from government and higher up to kind of, or advertise or suggest that they're supportive of this way of doing contracts, absolutely 100%. But there's also a local authority, our commissioning team, our procurement team, our directors, as well as our kind of councillors, who need to also have an element of belief in it, I think, and be willing, I wouldn't say to take a risk, because I think there's a less of a risk arguably by doing this, because we're paying by outcome, but it is about having a risk on doing things in a different way. And I think there needs to be open, good conversation on that. And obviously we've now got evidence for us in Norfolk to suggest that these things are working. So obviously for us, it might be a bit easier to move that along. But I'm sure if other areas were looking at that, I think, maybe there's an element of publishing some of this and making it a bit more, advertising it more, making more people aware is where I would go first of all.
Thanks, Sarah. Yeah, interesting. A lot of it does come down to awareness, but the initiative needs to happen locally. And I think that's something that's easy to forget when we're discussing these things in the abstract at policy level, is just how important the implementation at the local level really is. Kathy, please do come in, and then I just want to invite a couple of other people to offer some quick reflections before we close out. So, but you first, Kathy, please go ahead.
Hi, yes, thank you. I just had a quick question really for Hannah and Josh, which is about the cross-government commitment to the reports from the review. I'm particularly thinking about Department of Health and Social Care, given I was involved in government departments when Children's Social Care was part of Department of Health. Obviously moving over to DFE many years ago maybe made links with education easier, but it does mean that sometimes we have challenges in moving forward across health and social care on the children's side. So I just wondered what commitment there's been across government about review implementation.
Shall I come in on that one? So we have been, we've been really focused on making sure we have, make this a cross-government response to Josh's review and have proper buy-in from the other government departments affected. So DHSC have been really closely involved. We've also established a new interministerial group on child protection, which is looking at child protection, but also more broadly. So that's another place where ministers are coming together to all kind of accept their joint responsibility around these issues and make sure they're properly engaged with the reform programme. So yes, working across government always adds another level of complexity. It's never entirely straightforward, but it is something that's kind of at the centre of how we're trying to go about doing things. So we're kind of trying our best on it and getting somewhere, I think. Josh can come in and say whether he agrees.
No, it was actually to make it. Thanks, Hannah. I've got too many other things to talk about rather than getting other government department engagement in a complicated policy area. It was really just to sort of offer a quick reflection on this point about, you know, why is Norfolk doing this, and you know, what does it say for other areas and the relative role of central versus local government. I do think one of the observations, having done the review, is and making this observation to people on either side was never popular. But I think it is true to say that up until the government published their response, which is very welcome, prior to that, I think the policy environment for probably about 10 years had been one in which it was acceptable for local government to say, we want central government to do more to help us do this stuff that, frankly, local government should have been doing. And central government saying, look, there are some areas doing this, so everyone should be able to do it, and in a way sort of letting themselves off the hook for setting the policy environment to be one in which everyone is encouraged to do what the best are doing. And so people stepped away from the problem and didn't fully own responsibility for running better services for children and families. And I do think that both ends of that were really problematic. So it's good to see local areas with an appetite and a hunger for doing more, being more rigorous about this work, stepping into the space, and government confidently saying, we've got a clear direction we want to set here, this is what we're trying to do. I think that changes the tone in a significant way, and it does mean people are prepared to lean into it and take ownership. The specifics with Norfolk, I mean, Sarah, the Director of Children's Services, I think is a fantastic leader. An example of what her and her team did post-review, you know, they had Ofsted very, very nearly due to turn up to give them an inspection, and it was a significant inspection for them because they'd been rated inadequate or requires improvement a number of times. Despite the fact that that was due to happen, they still carved out a substantial amount of time to plan for post-Ofsted what they were trying to do with their services, and they've been doing work for years in advance of some of the reforms they're now looking at making. So leadership's a big part of it, but the fact that only a smattering of places have really got to grips with this says that there are deeper problems about funding, policy environment, inspection, etc. So it is definitely both, and I think we're getting there.
Great. Thank you, Josh. That's really, really helpful insight on that question. Just to finish off then, quick remarks from a couple of people that I think would be interesting just to hear some closing remarks from. One is Elaine Fulton, who's been working with the Children's Commission's Office on a universal outcomes framework for children, amongst many other things. So Elaine, it'd be great to hear your brief reflections. And then also joining us from Australia, David Pointer and Bridget Weller, who work in this policy sector down under. It'd be really interesting just to hear your reflections. Obviously, it's been a very UK focused discussion, but how familiar are these issues there? That sort of comparison can sometimes be interesting. So we've only got really literally a couple of minutes left. So brief reflections from you guys. Thanks.
I'll go first and try to be very fast because it's the middle of the night where you are, I think. So just really to reflect on and build on what's been said, and particularly from Josh, you know, you're talking about the centrality of leadership. For me, what I hear throughout this and everywhere is the importance of relationships at the heart. You hear it through the way that, you think about contracts, just hearing what Sarah was saying about the contractual arrangements, actually at the heart of that is building relationships across partners, building trust, building a shared language. And that goes to the heart of everything we're talking about. And I would urge, as Nigel has said, working with the Children's Commissioner's Office and lots of other people, including across government policy, to try to pull together this view, a shared aspiration of what success and good outcomes are for all children, young people and families. And that obviously includes the children that we're talking about today, to look across the system, to look really deeply within communities and engage the voice of children, young people and families themselves and what matters to them and what will make a difference to them. And finally, in terms of what we deliver, sometimes at the moment we deliver to children and families. It should be what we deliver for and with children and families. who's best placed to do that? And it comes up a lot in conversations about the relationships that exist already between those already working in communities, and how we can build that in so that you get a genuine multi-agency whole system approach to this, which will underpin the new family health system and everything else that we're building. So just to urge that system level view, and thinking about how we might share risk, share resource, and then share the outcomes positively and constructively together in a different way of working collectively and collaboratively. Probably taken too much time. So over to Australia. Thank you, Nigel. Really well said. Thanks, Elaine. David, Bridget?
Shall I go first? Okay, so, well, firstly, thank you so much for letting us join in today, and to reassure you that we face exactly the same issues, and a lot of the language and challenges voiced today, resonate very much with my day-to-day work. I think the thing I'm struck by is the bravery, particularly of Norfolk, in challenging services that have been built that make sense to us, and being really brave enough to rebuild them in a way that makes more sense for families. And that's where they've switched from that program thinking, I think, to that system thinking. And I think that's been a big part of what has driven their success, so that the family is seen as the change agent. And I think that's really commendable. There's clearly been a real commitment in implementation and leadership. And I would say, over and over again, as someone who spends a lot of time in placement prevention world, those are really key factors for that kind of change to occur. I think another thing that was mentioned earlier was that long-term commitment. So this idea of a long-term vision didn't sound like this was, 1 or 2 years. They've really got a vision of where they want to get to, and I think that really came across. So those were some of the things I was really struck by what I heard today, Nigel. Thank you.
Yeah, I might. Thanks, Nigel, and thanks. It's been really great to be able to listen today. What David is also modestly not mentioning is that he has really led introduction of FFT and MST in our organisation in Victoria. So that just, illustrates some of the similar issues that we're grappling with. One other observation that I just wanted to make along the way, one of the things we've done is that we have implemented one of the first social impact bonds in Victoria in the space of leaving care. And I was interested in your comments about Whitehall and their involvement, because our experience has been that with the support of Department of Treasury in Victoria, they became a really good ally, because unlike some of the other department portfolios, they could really see the savings to be gained across the sphere of government services that were being impacted on by the outcomes that young people were experiencing after they left care with inadequate support. So, if you can crack that nut, I think it's really valuable. But yeah, we've been looking at the MacAlister report ourselves, because we see a lot of the same systemic issues with too much resource being spent on assessment, not enough on actual care. So I wasn't aware of the government response, so we'll be very interested to have a look at that. Thank you.
Great, thank you so much. Always really fascinating to hear the reflections of people in different jurisdictions, and often the similarities are really striking. Great, we're out of time. Thank you all very much. Please do respond to our feedback survey. The link's in the chat. Do come along to the next edition of Engaging with Evidence. There are the details on that slide. All that remains for me to say is a massive thank you very much to all our presenters today, everyone from the Norfolk Project, Josh for joining us from the What Works Centre, and all of you who have offered comments, reflections, thoughts and engagement. So thank you all very much, and enjoy the rest of your days. Thank you.